Hi, I'm Dr. Adil Hassan. I'm a consultant doctor practicing in the field of cancer specialization. In this clip, we'll talk a little bit more about chemoports, or in medical terminology, the indwelling catheters. If you haven't seen part 1 of this clip, I request you to do so for better understanding of the contents of this clip. Over the next few minutes, I'll discuss in brief regarding more about chemoport and how it is accessed and what are the advantages of using a chemoport. Like I mentioned in the last clip, it is a small device the size of a coin which is placed surgically under the skin of the chest, which provides us easy access to the chest veins. Procedure to place this device is quite simple. Incision size is approximately 1 inch and can be done under local anesthesia. It takes approximately half an hour for the procedure and chemotherapy can be given on the same day a few hours later. Patient can be discharged as early as the very next day. An adhesive bandage will be put over the incision, which will be removed over a duration of the next few days. And once the wound is dried, the patient will not feel any pain at the site of the device. Maybe the device is felt as a little bump under the skin if you are pressing it deeply, but otherwise you won't feel much discomfort. You can resume your day-to-day activities, including application of water in and around that area. Now, every time the patient comes to chemotherapy, this device is accessed using a special needle which has a right angle tip. As shown in this diagram, you can notice how the device is placed under the skin and above the muscle. Now, medicines are mixed with the IV fluids. They are connected to the tube, and from the tube it goes to the needle, from the needle into the hub, from the hub into the tube, and from the tube into the vein. So the whole process of accessing the device is only as painful as a simple prick which is done to draw blood investigations for a routine investigation. So once the chemo is done, the external needle is removed and the tube is removed as well. The advantages of using a port is it is a one-time procedure. Once the port is placed, it will remain in place for the entire duration of the therapy and even afterwards. There is minimum risk of complications like extravasation. Patient can avoid trauma of multiple pricks. The hands are free during the infusion period, which is more so important during prolonged infusions. It is maintenance free, that is, in compared to PICC line, where there is a tube sticking out of the hand, chemoport is essentially maintenance free. In summary, if you or your relative or a friend is undergoing chemotherapy, make sure you discuss with your healthcare provider regarding chemoports. Thanks a lot for your valuable time. If you like this video, please give a thumbs up, share and subscribe to this channel. Thanks a lot.